Welcome back again. Lecture 2, Part 5, Pain Throughout the Organ Systems. We're going to start out by talking about rheumatoid arthritis. Rheumatoid arthritis, as mentioned earlier, is an autoimmune disease that attacks the body's joints, among other things. In children, it'll also cause hepatosplenomegaly, or a very large liver and spleen accompanied by fever. Females are 2 to 3 times more likely to get rheumatoid arthritis than men. In fact, as long as we're on the subject, women are more often affected by autoimmune diseases of just about any kind. It's most common between the ages of 40 and 70, but people can get RA at any age. We think that the autoimmune disease has a genetic component or it runs in families, but that also there must be an exposure to a specific, as yet unidentified, antigen to manifest the attack on the immune system. Like osteoarthritis, joints will be inflamed, but the inflammation in RA is much, much worse. Where the typical locations of osteoarthritic attack were the wrists, hands, and knees, and feet, rheumatoid arthritis also attacks the little joints between the fingers and the elbow. RA is disfiguring, as you can see. Well, osteoarthritis shows very little outward signs. Since RA is an autoimmune disease, it affects the entire body. The immune system activation will cause fever and general fatigue, could lead to peritonitis or an inflammation of the pericardium around the heart, or effusion, excess fluid, around the heart or lungs. Scleritis, or inflammation of the sclera, the whites of the eyes, is also associated with the autoimmune attack by RA. Notice something here. I wanted to show you. What was it? It was scleritis, pericarditis, and arthritis. Scleritis, pericarditis, and arthritis is a triad of rheumatoid arthritis. When you have all of those three, it's pretty diagnostic. Blood tests will show all the typical suspects for an inflammatory response. Increased ESR, erythrocyte sedimentation rate, and C-reactive protein. Where have we seen these before? Also, as in any joint inflammation, we look for rheumatoid factor in the blood because that will diagnose rheumatoid arthritis. Unfortunately, at this time, there's no cure for RA, and the treatment options to reduce the inflammation and pain have many side effects. Do you remember those commercials on TV where they spent more time talking about the side effects than they do about the drug? Anyway, sciatica. It's extremely common. If you remember from your anatomy, the sciatic nerve is a huge nerve that travels from the lower back through the sciatic notch in the pelvis and down the leg, where it changes names a few times, but eventually its fibers actually reach all the way to the foot. Go ahead and ask anyone who has sciatica. They can tell you exactly the path of the nerve. With sciatica, the nerve is being compressed or pushed on by something. It could be scar tissue, a spinal disc misalignment, or even a tumor. But the nerve still gets compressed, and symptoms can be anywhere from a dull pain radiating down the leg or very short gluteus to malfunctioning nerves to tingling. In severe cases, patients might lose bladder control because of the lost innervation to the voluntary sphincters. An X-ray might find the source of the pressure, but CTs and MRIs would be much more useful in identifying the exact cause and damage to the sciatic nerve. Do you know anybody with sciatica? Osteomyelitis is a nasty infection that involves both the muscle and the bone, and it's basically an eating away of the tissue. It can be seen in patients with diabetes, mellitus, but more often it's a direct result of a really bad infection from a Staph aureus or Pseudomonas bacteria. The infection might have gone systemic and caused typical symptoms associated with an infection, or it might stay local and just eat away at the muscle and bone, causing severe pain. The blood test would include looking for an increased white blood cell count and CRP. Why do we see that again? Increased CRP? Also, it's important to culture the wound since Pseudomonas is a gram-negative bacteria and Staph aureus is a gram-positive bacteria, so the treatment will be different antibiotics. In the worst case scenario, and this is the worst case, amputation may be required to avoid the spread of the disease. Cellulitis is a general catch-all kind of phrase that means something is causing a problem that is destroying the cells, usually in the skin. Usually the rash is from bacteria such as staph or strep, but it can also be due to fungal infections or physical injury. Insect bites are also known to cause cellulitis as the poisons enter the dermal layers and destroy underlying tissues. Typically, we'll see cellulitis in the lower extremities. If the cause was due to diabetes, that's especially true. By the way, CNS means culture and sensitivity test. So, that's it. We've completed yet another topic in pathophysiology. Congratulations, and I will see you in class.